Hello, I'm Diana Keogh, Editor-in-Chief of ShareWeek.com. Today we're talking about osteoporosis with Dr. Andrea Sikon, who is the Chair of Internal Medicine at the Cleveland Clinic. Dr. Sikon has agreed to take questions from our members that have come in off the internet. Dr. Sikon, the first question that has come in is from Lori, who lives here in Atlanta.
Dr. Sikon, how beneficial is weight-bearing exercise, like power walking, for prevention, and how young should it be started?
That's a great question. Really, it should be started in our adolescence. We peak our bone density in our 20s to 30s. So anything we can do to peak that bone mass as high as possible. And again, that starts, our bones are growing since the day we're born. So really trying to peak that out. If we're trying to treat osteoporosis, weight-bearing exercise is very important for the bones, but also to strengthen the muscles, because that's what is going to reduce our fall risk, and that's going to significantly reduce our risk of breaking a bone, which is the whole reason why we care about osteoporosis and our bone density.
I've heard a rumor that drinking caffeinated beverages leaches calcium from my bones. Is this true, and is the damage irreversible?
So there's also interesting research about this, and some of it isn't as hard fast as what we might think. Bottom line is stop drinking soda or minimizing soda intake. That's really, really important. It's not a permanent loss in the studies that I've seen. So really making sure that we're getting enough milk. Skim milk is a fantastic way to get your calcium, and if you're not lactose intolerant, and is probably a lot more healthy and has actually been linked in some studies to help you lose weight.
If I have a family history of osteoporosis, is there anything I can do to prevent it or reverse the effect?
Now, family history is definitely a strong risk factor, but certainly not the only risk factor. So there are definitely things you can do to impact that risk and lower that risk. Making sure that you take enough calcium and vitamin D, getting that weight-bearing exercise, not smoking, not drinking excessively. Those are all things lifestyle-wise that you can do to make sure that you stay healthy and balance out those risk factors that you can't change.
Dr. Sikon, I'm hoping you can help me. My mother was 5 feet 8 inches and a beautiful woman. She was put into a nursing home. It was time to weigh her and take her height. And they said she was 5'5", maybe. And I said, no, that's not possible. And I remember looking at the top of her head. And of course, she was suffering from osteoporosis, my aunt as well. So I'm obviously very concerned about it. I've been consulting with my doctor. And with the recent reports that are out there right now, I'm really concerned about the risk versus benefit factor and whether I should be going towards supplements. Or I really need some direction on this. I'm hoping you can help. Thanks.
So that's a great question. You know, we're always worried about medication side effects, and anything you take, even if it's an over-the-counter medicine, has a risk to it. Even aspirin, acetaminophen, which is Tylenol, they all carry risks. So it's a great way to think about it is that risk-benefit ratio that you were talking about. That risk is extremely, extremely small versus the risk of the insufficiency fracture that you were referencing. So the risks clearly are much, much less than the benefits, and I would definitely stay on the medication, but have a discussion with your personal physician to find out what's right for you.
Dr. Sikon, thank you so much for joining us here on ShareWeek.com. This has been really helpful. If you'd like more on this topic of osteoporosis, please go to our website at www.shareweek.com.